Here's a very sobering statistic for you. 1 in 8 women in the United States will develop breast cancer in her lifetime. 1 in 8. And most don't have the life-saving information they need to decide even on a treatment plan. Dr. Deepa Halaharvi is a breast surgeon and a cancer survivor. She's here today with survivor, patient advocate, and CEO of the Young Survival Coalition, Jennifer Merchdorf. Good morning, ladies.
Good morning.
Hello.
Dr. Halaharvi, I'll begin with you by asking to explain what exactly early stage breast cancer is and how it's typically treated.
Yes, in the United States, 1 in 8 women gets diagnosed with breast cancer. Early stage breast cancer is a non-aggressive stage 1 or 2 breast cancer that is most commonly seen in the United States. Up until now, we treated breast cancer with some form of combination of surgery, chemotherapy, radiation, anti-hormone pills, and targeted therapy. Most recently, in the last decade, we developed a test called Oncotype DX. It's a genomic test that looks at the tumor biology for the patient, and it tells the woman whether she needs chemotherapy or not. And this really has been practice changing for us in terms of treatment of breast cancer. There's a large study that looked at over 10,000 women that also looked at this test for women who are diagnosed with early stage breast cancer. And really what we found is majority of the women do not need chemotherapy, but we also know for those women who do need chemotherapy, it can be life-saving.
It's fascinating. Jennifer, if you don't mind, share a bit about your journey with breast cancer. How old were you when you were diagnosed, and how were you treated?
Sure, Angie. So I was 36 years old when I was diagnosed, and that was actually 9 months after my mother was diagnosed with breast cancer. And the reason I think that's important for this discussion is because we're talking about age. Young Survival Coalition, YSC, we decided to partner with Genomic Health to have this conversation, to ensure that all people know that young adults can and do get breast cancer, and that if you're facing a diagnosis, make sure you're asking your doctor, am I getting all the tests that I should be having? And then partner with your doctor on the results. That's the most important thing you can do.
Well, what are some of the mistakes that we make, especially young people, when we have this diagnosis? What do we need to do next? What's the next step?
Well, it's definitely very important to ensure that you're taking care of yourself, you're finding community, finding other people, young people do get breast cancer, and then educating yourself. Partnering with your doctor is also so critical because you want to be making those decisions together, and you want to make sure that the decisions you're making are what's right for you, because we're all very different, and we treat breast cancer now very individualized, and that's important.
It sounds just like the greatest wisdom of all time. Dr. Halaharvi, let me ask you about this genetic test. Is there a limit to what age you can be to have this test, or is that a problem?
Yes, so age is not a factor. So any age, women of any age should be eligible to get this test as long as it's hormone receptor positive early stage breast cancer. And unfortunately, we found out based on a National Cancer Institute data that women younger than age 40 or older than age 70, they're not getting this appropriate test. So I'm here today to empower and educate women and tell them that this is a test that you should probably ask your physician if your physician is not ordering it for you, and if you have hormone receptor positive early stage breast cancer.
And can you, doctor, send our viewers to a website where they can learn more?
Yeah, it's nomattermyage.org is where they can go and find out more information.
Ladies, thank you so much for your transparency and for sharing your wisdom.
Thank you so much.
We'll be back with more local lifestyles right after this. Stay with us.